Welcome to graduate medical education at Prisma Health. Prisma Health partners with the University of South Carolina School of Medicine in Columbia and Greenville to offer more than 60 residencies and fellowships. With approximately 650 residents and fellows, we view education as integral to improving community health and are committed to providing the best training possible. Our clinical campuses prepare today's clinicians for tomorrow's healthcare. From our Simulation Center to Advanced Research and Innovation Center, we are on a journey to transform healthcare. As South Carolina's largest healthcare system, Prisma Health's unique collaborative environment fosters new solutions for care delivery, access, and affordability, all with the goal of helping people live healthier lives.
I think what we as faculty bring to residents is a dedication to the craft. As a result, I think we feel very strongly about making sure that it is not only a robust and full learning experience for residents, but also one that is humane and one that balances all of the needs of our learners, both in terms of academics, but also in terms of lifestyle.
Residents as teachers is actually one of our really important components of our curriculum. So our residents get to be involved in improving their own teaching and then practical experience teaching students clinically and then also in the classroom.
I think that the Prisma Health partnership with the School of Medicine has been a tremendous asset to my own education. Having gone to medical school here as well as attending residency here, the access to the sheer number of specialists that we have and I guess the size of the Prisma Health organization just gives us a lot of variety in the clinical things that we see each day. Our residency program is quite outpatient heavy and I feel like I get a really good, solid training in managing a wide variety of outpatient issues.
Many of the patients that we see here are medically complex and unfortunately have to navigate through a weak social safety net. As a result, as a resident and as a physician, we have to think out of the box just to provide the best care.
It's intentional and strategic in being inclusive, promoting diversity, promoting retention, and promoting learning, but also having fun while you're learning. I think what we've done is we've tried to recruit a diverse group of residents to really represent the diversity of our community, which is really rich. And I think we all learn from each other with that.
Diversity, equity, inclusion are central to ethical patient care, I think. Most of my patients have had very different life experiences from me, and I think that it's really hard to come up with a good plan of care for someone without understanding their background and their lifestyle and their values. And so I try to keep those things in mind with every patient and every decision that I make.
I'm actually one of the chair residents on our diversity, equity, and inclusion boards. So I participate heavily in that. There are always a lot of lectures on these topics. You can attend hands-on training on topics such as cultural sensitivities and personal biases. And of course, all residency programs, you have the opportunity to join the leadership board there.
We have a lot of patients here that it brings light to their day, that they can see someone that looks like them, that they can relate to. Our program has the residents actively participate in the recruitment process and interview process of medical students that are applying to our program. And overall, the goal is for us to provide the best care to our patients. What better way to do that than to add diversity?
Culture of my residency program, if I had to come up with one word to describe it, is supportive. We are family medicine, but I think of us as like a big family. And it sounds cheesy, but it's so true in this case. I feel like I can ask any of my upper levels a question at any time. They're always available to provide support, just lend an ear, or just hang out on the weekends.
We see health and well-being as keys to success. Our culture of wellness sets us apart from other training programs.
Prisma Health is a huge advocate for wellness, not only for residents, but for all Prisma Health employees. Being a Prisma Health employee, you have free access to mindfulness and meditation apps like Headspace, which I really enjoy.
In addition to that, we also have kind of lecture series about kind of what wellness is, how important it is, management of fatigue, and kind of that burnout area that everyone tends to talk about during residency, and tips, tricks to avoid that, which is really important. The faculty make a huge effort in emphasizing the need to kind of be away from work once you are outside the hospital.
There's lots of things to do within the system and the city and things to engage in to stay well. And I think access to services and resources and being able to provide those and the time to engage with them for residents is really important.
Where you train is important when choosing the right program for you, and training opportunities abound in the Midlands of South Carolina. From the vibrant capital city of Columbia to the small town charm of Sumter, Prisma Health has the right fit for you. Prisma Health Richland Hospital in Columbia is the region's premier referral center and hub for our many residency and fellowship programs.
What is different about our program is our culture of family and support that each trainee will experience.
I think the thing that makes the Prisma Health faculty stand out above all else is just the overall willingness and dedication towards your growth and development, and just make you feel like you're supported at all times, which is really important to have.
Columbia is very affordable, with the cost of living well below the national average, a thriving downtown, and seemingly endless variety of outdoor and cultural activities. Columbia is also home to the state's flagship university.
Columbia is a great place to live and work. One of my favorite things is the Riverwalk here. We have many miles of trails lining our rivers.
I have really loved the connection to the outdoors that's here. There's a national park that's just half an hour away. That's a lot of fun to kayak on or go hiking in. There are so many different things to explore in the city itself, from Soda City Farmers Market, which is just a wonderful marketplace for food and arts, museums, music. So many things to explore, but in a very accessible way. I think there's a very noticeable atmosphere of growth and liveliness.
Those wanting a rural training experience need look no further than Prisma Health Toomey Hospital in Sumter, which is just a short drive from larger cities like Columbia and Charleston.
We're pretty close to the beach. We also are pretty close to big cities. Atlanta is not too far away, Charlotte. We do have a YMCA, we have a CrossFit gym. We also have a public park called Swan Lake, where residents and students sometimes go to relax and have walks.
From primary to specialty care, Columbia to Greenville and beyond, Prisma Health offers a program and setting to satisfy most everyone. Our approximately 36 fellowship programs range from child and adolescent psychiatry, cardiology, and clinical informatics to infectious disease, primary care sports medicine, and vascular surgery. As for residency programs, nearly 30 are located between Sumter and Seneca. Wherever your clinical interests lie, Prisma Health will open new doors to one-of-a-kind training and career opportunities. It's no surprise that more than a third of our graduates stay in South Carolina to practice, with about 2/3 of those staying on at Prisma Health. Retention of graduates is a hallmark of our program, increasing access to care for the communities we serve. Prisma Health and the University of South Carolina School of Medicine in Columbia and in Greenville invite you to join our journey as we transform healthcare, one physician at a time. For more information, visit prismahealth.org/GME.